Nurses are exhausted. They're pushed to the brink. We've had enough. We are here today for this rally to let them know that we won't take this anymore.
We're having patients waiting up to 6 hours at times, patients in the waiting room extremely unwell, and we're not able to see them or get to them or give them any treatment just because we're so busy inside.
Who on earth wants to work in these situations? We walk onto our ward and we are short-staffed by 2 to 3 on numerous occasions. And we're told when we ask, is there anything can be done about it? We're sorry, but that's it. That you're just going to have to cope because that's all we've got today. That's not good enough. That's not good enough for our patients. That's not good enough for us.
The impact that leaves on the ward is very unsafe patient cares and not being able to attend to all the patients' needs.
What does our health department come to when staff are sent memos expressing just give out medications today because that's all we can handle? Stand up and fight back! Stand up and fight back!
They tell us that we're the premier state. Well, when it comes to looking after our health services staff, we're running very much last.
We are sick of hearing the same old rhetoric from the Liberal government. This is a government, their MO is always to cut working conditions and pay from people. And that is exactly what they are doing to you.
The time for cupcakes and applause is over. What you need is proper conditions and what you need is proper support to provide the care that you do. So federal Labor supports you.
Our senior staff are leaving in droves. They cannot cope with the increased workloads. Our patients are staying in longer. They're having worse outcomes, more falls, more risks. It's not good enough.
We really need our patient ratios. We need more nurses.
This is happening every day of the week. I'm tired. My colleagues are tired. This is ridiculous. It can't go on any longer. It's wrong. Somebody's going to die, and we're just going to have more coroner's cases. You mark my words. I don't want to see this, but I care about people that come through this hospital.
What we need is safe staffing across all shifts. That's ED, ICU, maternity, each shift. Not 24 hours, each shift. I don't want you to count my empty beds at midnight. I want you to count my full staffing for a day shift.
Yes.
Our midwifery ratios, we need 1 to 3. That's 1 midwife to 3 mothers, plus the 3 babies. Let's not forget, we're not counting our babies either. So we all need to stand together, be united, and we can get this done.
Nurses and midwives rallied outside John Hunter Hospital today, calling for better staff to patient ratios ahead of one of their busiest times of year. And with some GP access after-hours services reduced from Christmas Eve, hospital workers are worried the emergency department will face even more pressure.
We already have 8-hour waits in our emergency department, and we believe that by closing this or at least reducing the hours, that will increase those waiting times.
I want to tell the government that they need to up this.
We are the busiest emergency department in the state and are seeing significant numbers of presentations. Many of these patients will be seen through the waiting room. From midnight to midday, this area is only staffed by 2 registered nurses. During this time, there are often extended waiting periods up to 8 hours and above. This has led to multiple occasions of people having cardiac arrests, seizures and strokes in our waiting rooms.
We all need mandated ratios, 1 to 3 in ED and 1 to 4 on the floor.